Coronavirus Philippines. Is it safe to travel? In this video I'll give you information around traveling to the Philippines with the outbreak of coronavirus expanding at this stage on a daily basis. In particular, is it safe to go to the Philippines, and will you be quarantined for 14 days when you arrive in the Philippines? If you're traveling to the Philippines soon, then you'll need to watch this video. If you're planning to travel to the Philippines shortly, be sure to check out holidayescapetravel.com, where you'll get all the very best prices on fares and accommodation online. It's my own travel comparison website, and do yourself a favor, check out holidayescapetravel.com before you book anywhere else. Being that I'm no medical expert, I wasn't planning on doing any videos on coronavirus outbreak, but I've had many people asking me about whether it's safe or not to go to the Philippines under the current circumstances. Now, I can only give my own personal opinion on that in this video, but I'll also take a look at a government website here in Australia that gives some great information as well. But in the end, it will be an individual decision you need to make as to if and when you may travel to the Philippines and what precautions you may take when in the Philippines. I strongly suggest everyone do their own research on this and keep a close eye on all travel warnings and reliable information sources in regards to the spread of the coronavirus. My own personal opinion is that right now, for me traveling from Australia directly to the Philippines, I would definitely still go. Now, I'm doing this video on the 27th of February 2020, so that's as of this day. So I would take a supply of good quality face masks with me just in case, but at the time of me filming this video there are very few confirmed cases, if any, of coronavirus in the Philippines. If coming from Europe or the USA, I would try and avoid any stopovers in China, Hong Kong or Macau, because you will not be allowed into the Philippines full stop. You will need to be patient, as I'm sure extra screening processes will be going on in most countries, which will cause extra delays at airports. So let's jump over to the computer, where I'll take a look at the Smart Traveller website, which is run by the Australian government, and I'm sure many governments around the world will have similar websites. I believe it's always good to follow the advice from government websites around travelling in foreign countries. Okay guys, so here we are on the smarttraveller.gov.au website, which, as I say, is an Australian government website on travel warnings all over the world. Now, I've already brought up the Philippines page on that site, which is asking for any travel warnings there, and straight away at the top we can see there is a big alert there. There is an active outbreak of coronavirus, which we'll have a bit more of a look at in a minute. Now, I hope that the lighting here and everything is okay. It's really hard where I'm doing this to get great lighting, so I hope you can see this okay. Now, as you'll see, the last update on this page, it was updated on the 17th of February 2020, and it's still current as of the 27th of February 2020, which is today when I'm actually filming this. By the time this goes on to YouTube, it may be a day or two from now. So always check the current advices. So you will see on this page, it will also tell you about any other travel warnings in the Philippines. So things like for your safety, it'll tell you about terrorist attacks could occur anywhere in the Philippines. Possible targets includes public transport, hotels, shopping malls, etc. And it will give you a whole lot about that, even about the Taal volcano. But really we're here looking at the health warnings around the coronavirus. So down here where it says health, multiple cases of the novel coronavirus were reported in the Philippines in early 2020. If you've traveled to China, including Hong Kong or Macau, in the previous 14 days, you'll be refused entry. So if you have come through, even if it's a layover through China, Hong Kong or Macau, they will not let you into the Philippines.
It says expect additional health screening at entry points. If authorities suspect you're infected, they may need you to stay in hospital or be quarantined. And again, I believe that quarantine period is 14 days. All airlines are handing out health declaration checklists on arrival. If you have symptoms of respiratory illness, contact your doctor before travelling. So medical facilities are adequate in the major cities of the Philippines. However, facilities are limited in country and remote islands. Ensure your travel insurance covers medical evacuation. So they're saying there's also measles and polio outbreaks across the country, including Manila. So get vaccinated before you travel. Malaria and dengue are also common, especially in many provincial areas. Zika virus is widespread. So repellent is probably going to be a very good idea in combating a lot of those mosquito-borne viruses. They're talking here also about foodborne, waterborne and other infectious diseases include cholera, typhoid and hepatitis. Drink only boiled or bottled water, and so on. Now, the travel part to do with the coronavirus, we've already spoke about being not allowed to come through into the Philippines if you've been to China, Hong Kong or Macau. You don't need a visa for less than 30 days if you're going to the Philippines. That's from Australia, and I think it's the same in US and a few other countries. Keep your visa up to date, carry proof of onward return ticket. So all those things are all there. More on the coronavirus, we click up here. So what is the coronavirus? Well, if you're wanting to know what it is, here it is. Coronavirus are a large family of viruses that cause illness from common cold to more severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. Initial human infections of the novel type of coronaviruses were acquired from exposure to animals at live animal market in Wuhan, in China. On the 20th of January, Chinese authorities confirmed the novel coronavirus is spreading person to person. It remains unknown how easily the virus spreads from person to person. Limited to person transmission has now been confirmed in a number of countries around the world. The disease caused by the coronavirus has been named COVID-19 by World Health Organization. Common symptoms of the disease include fever, cough, difficulty breathing. Severe cases can cause pneumonia and even death. So what they recommend, before you travel, talk to your doctor before traveling with young children, babies or an elderly person. If you're pregnant, if you have a weak immune system or have chronic medical condition. Read the travel advice for your destination. We are updating them regularly. There is heightened risk of sustained local transmission in some countries, including at this stage Japan and South Korea. Read our advice about infectious diseases and medical assistance overseas before you go. Check with your travel agent, airline, cruise operator, accommodation provider and travel insurance provider to consider your options regarding any potential changes in services. Understand the risks you're taking and the efforts to control the spread of COVID-19 may cause further travel disruptions and restrictions. So when you're in the Philippines, to minimize your risk of exposure to this and other infections, we recommend avoid all high-risk areas such as farms, live animal markets, and areas where animals are slaughtered, including fish and seafood. Contact with animals alive or dead, including pigs, chickens, ducks, wild birds, surfaces with animal droppings or secretions on them. If you come into contact with any animal or animal products, avoid touching your eyes, nose and mouth until you've thoroughly sanitized your hands. Wash your hands often with soap and water or alcohol-based hand sanitizer before and after eating and after going to the toilet. So you can get some of those hand sanitizers you can carry around in your pocket or in your bag. They're not very expensive, and I'd take a heap of those and regularly wash your hands with those throughout the day. Avoid contact with others, touching, kissing, hugging, and other intimate contact, especially if they are sick. Monitor your health closely. If you develop symptoms, fever, cough, sore throat, tiredness, or shortness of breath, you should arrange to see a doctor for urgent assessment. Follow the advice of local authorities. Contact your airplane or travel company for information about changes to flight services. You do not need to wear a face mask if you are well. Surgical masks in the community are only helpful in preventing people who are infected from coronavirus spreading to others. However, if you're traveling in an affected country, you must follow the advice of local authorities. Personally, I would still, if I was going for a couple of weeks or more to the Philippines, I'd be taking a few face masks with me just in case when you're there things started to get a little bit worse in the Philippines, because no one knows what's going to happen tomorrow, let alone in a couple of weeks, 2-3 weeks, a month from now. So it just goes on here to say about many countries have introduced entry restrictions and screening measures at border crossings, etc. So you will be held up for questioning to make sure that you're feeling okay at time of coming in. But I believe the dangerous thing with this is that people can feel totally fine and still have that disease and spreading it to others. And this is where it can be tricky. They might not feel sick for a few days after that, and they've already infected, 3, 4, 5, 10 people, who knows how many.
So guys, I hope this information has helped you understand a little more about any concerns you may have had around the coronavirus outbreak. As I said earlier, this virus is widespread and will most likely get worse before it gets better. So keeping a close eye on all information is essential when traveling. If you personally are too worried, then I would say delay your trip to the Philippines. But for me right now, if I'd planned to go to the Philippines, I'd still be going unless cases started popping up more frequently in the Philippines. I'll stress again, the views I have given are my own, and in no way am I a medical expert. Everyone needs to gather the best information they can and make a decision yourself. I'm not either encouraging anyone to stay at home or to travel to the Philippines. As I say, this is your decision alone to make. If you're looking for good travel information, be sure to check out the card on screen now. Feel free to like and share the video, subscribe and press the bell icon for all future videos. Thanks for watching. I appreciate your support. Take care and bye for now.